I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 66. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about cold and flu season and how to keep your immune system strong. What to do to keep it strong, and then what to do if you do get sick. Kind of important stuff. So if you missed some of this, all this is going to be on my website, drjoe.com, audio and video. You can download the audios if you want. We have a segment on SoundCloud, so if you want to download, you can. Watch the videos. We want to give you as much information as possible for you to take control of your own health. It's a scary time. What does everybody talk about on the news? Well, this politician wants to take all your benefits away, and they want to take away your insurance. Insurance stinks. Let's call it what it is. Nobody's saying that insurance is good. Because years ago, people come to us and say, Dr. Joe, I want to get a new insurance. What's a good insurance? There are none. There's only about 3 insurance companies left anymore. And with deductibles and copays and what they don't cover, and they say they might cover it, and then you send the bill and they don't cover it, and it's a mess. So you think you have problems. Imagine us doctors when we have hundreds and hundreds of patients coming in and dealing with different insurance companies and different policies within the insurance company, and some cover and some don't, and some might, and some you have to ask, beg your mother, may I? And it's a mess. But here's the thing. If you take control of your own health, you're not going to need your insurance nearly as much. And also, if your insurance doesn't cover a procedure and you need that procedure, get it done, pay for it. I know that's a hard thing to hear. Well, I have insurance. I'm not going to get treated because my insurance doesn't cover it. It's your life, folks. Don't let the insurance company dictate the care that you need. But again, if you take control of your own health, you're not going to need nearly as much care. That's what we try to do these shows for. If you need care, absolutely get it. And I co-manage a lot of cases with my medical colleagues, my psychiatric colleagues, my dental colleagues, nursing colleagues. We all work together to try to get the patient well. So that's the only good thing that's come out of this insurance mess, is that all doctors are now working together to help each other. It's kind of fun. Back to vitamin D. Can't stress this enough. If you're not getting sunlight, you got to get it from an outside source. It's not really in food. And the vitamin D2 is a synthetic version. Not happy with that. I think you should go with the vitamin D3. One of the reasons why colds and flus are so common in the winter, sunlight isn't hitting the skin. You don't have as much vitamin D. Think about this. You never hear about a flu outbreak on the equator or in tropical countries. Why is that? Well, all the things we're talking about here. They're probably eating more fruits and vegetables. They're getting a lot more sunlight. They're outside more, fresh air. And so they're doing all the things that we don't do if you're in a colder climate. And usually flu is worse the further north you go. Well, gee, now it's starting to make a little sense here. And again, no matter how much sunlight you're getting, if you're out in the winter, you're not going to get those UVB rays from the sun to interact with cholesterol to create the vitamin D. If you're on cholesterol-lowering medication, another reason you got to get your vitamin D levels checked, because you may not have the cholesterol that your body needs to produce the proper amounts of vitamin D. According to an international research team, one person would be spared from influenza for every 33 people taking a vitamin D supplement. Got it? So 33 people take it, one person is going to be spared. 40 people have to receive a flu vaccine to prevent one case of the flu. This is one research team. So again, I'm not a medical doctor. I'm not a vaccine researcher. Well, I do research it. So basically what we're saying is vitamin D levels are more effective than the vaccine, according to this one research study. Interesting. So among those with severe vitamin D deficiency, 1 in 4 people taking vitamin D supplement would be protected from the flu. So those are the people that are really severely deficient. So it's really important you keep those vitamin D levels up. It's really inexpensive, easy to take. Dr. Joe's vitamin D is a liquid, flavorless, a couple of drops in your mouth and you're done. And the nice part is you can mix it in with your food if you want. You want to aim, the studies, the medical research says you want to do about 40 to 60 nanograms per milliliter if you get your blood work done. I like between 60 and 80. Those are the numbers. I like vitamin D just a little bit higher. So really important to make sure those vitamin D levels are where they need to be for you and your kids, everybody. And the elderly, please folks, check their vitamin D levels. It's such an easy, cheap fix. Now, if you're coming down with a cold or flu, you haven't been taking your vitamin D on a regular basis, you can take up to 50,000 international units a day for 3 days for an acute infection. Now, if you take vitamin D2, the doctor will give you 50,000 international units. That's how they measure vitamin D. I don't know who decided that. 50,000 international units of vitamin D once a week. I don't like that, my opinion, because your body can only absorb so much. If you remember earlier, we talked about vitamin C and you can reach your bowel tolerance. Well, you can reach your bowel tolerance on anything. And so I like to spread out my supplements. That's why I take Super Greens and Essential Source once a day instead of taking a bunch of it once a week. Spread them out. I like to spread out the vitamin D and make sure it's vitamin D3, not vitamin D2. 50,000 international units for 3 days. And, some doctors, even one researcher, Cannell, says that a dose as high as 1,000 units per pound of body weight. Now, I think that's a little excessive personally, but if if you're sick, 50,000 units just for 3 days and then go back to your normal dosage. If the vitamin D doesn't work because you've never been exposed to this virus or whatever, this pathogen, you might want to also then consider adding the vitamin C to it as well. We talked about that earlier. So you have steps you can take. I got to talk about zinc and beta-glucan. I need more time. There's just not enough time in these shows to cover everything. Third nutrients, because I told you to talk about 4 nutrients, and if I have time, I'm going to talk about some other things you can do to keep your immune system strong. Zinc. Zinc can reduce the duration and severity of your cold if taken at the first signs. That's why a lot of these supplements you'll see advertised during cold and flu season, take it at the first sign. A lot of people are zinc deficient. You're just not getting enough zinc in your diet. That's, again, fruits, vegetables, nuts, and seeds. Now, you can get zinc from animal products as well, because the animals will concentrate it in their organs or in their flesh, but I'm not a big fan of that. I'm not a big fan of animal products for many, many, many reasons. So I'd rather see you get it from a plant-based source. Zinc is a constituent of over 3,000 different proteins in your body and a component over 200 different enzymes. If you don't know what enzymes are, I got to give you a crash course in enzymes. You're a sack of chemicals. I'm a sack of chemicals. All we are is a sack of chemicals. What makes us alive? If we took all the chemicals out of our body and put it in a bag, that bag would not be alive. Why are we alive? Enzymes come in and interact with these chemicals to create blood, tissue, nervous system, nerve impulses. The enzymes are the thing that keep us alive. And as we get older, our enzyme levels drop dramatically. It's called aging. So if we can keep those enzyme levels high, we slow down Father Time, which is pretty cool. Where do you get enzymes from? Well, your body produces them, your pancreas, your liver, your saliva. But you can also get them from outside sources. And you get that from raw fruits and vegetables. Anything raw, actually. Raw meat would have enzymes in it. I don't recommend you do that, though. Raw fruits and vegetables. And that's why I suggest you have something raw at every meal, always. Whether it's a salad, broccoli, cucumbers, tomatoes, avocados, papaya, pineapple. Something raw at every meal. The more raw food you eat, the higher your enzyme levels are going to be. Now, some people, if their immune system and their digestive system is really just beat up, they might have trouble with raw food. So that's why I recommend Super Greens and Essential Source. We take fruits and vegetables, juice them, take the water out at a very low temperature, and what's left is a powder. Then we add prebiotics, probiotics, digestive enzymes, a complete multivitamin, that's Super Greens. Essential Source, Super Greens is wheatgrass, barley grass, and alfalfa grass, omega-3 fatty acids from chlorella and spirulina, the purest form of omega-3 in the world. And then we add dulse and sea vegetables to both of them because they have iodine in it. And so many people are deficient in iodine because we don't eat a lot of sea vegetables. So that's why I recommend the Super Greens, the Essential Source. Very easy to digest, especially if people have trouble with raw fruits and vegetables. Then as the colon starts to heal, the little tears in the gut start to heal, leaky gut syndrome. We talked about that already many times. Then you're able to start introducing more raw foods. But this is a real simple, easy, inexpensive way to get those enzymes into the body. But you got to get those enzymes in there to make it work. And zinc is part of over 200 different enzymes. Zinc increases your production of white blood cells, fights infection. It keeps your immune system strong and helps release more antibodies. This is why if you have zinc lozenges, it's good to have those around. As first sign, a little runny nose, scratchy throat, start taking some zinc lozenges. Make sure you're getting zinc year-round, of course, and then you don't have to worry about it. But if you do feel it, again, how to keep yourself healthy and then what to do if you do get sick. Zinc acetate is a good way to do it. There's zinc acetate, zinc gluconate, zinc citrate. If you had to pick one, zinc acetate probably just a little bit better than the other ones. You want to get that if you're doing a lot of cooked foods, a lot of foods that are not organic, because cooked food will destroy the enzymes, and if it's not organic, the soil may be deficient. This is another reason why you want to try to do as much organic fruits and vegetables, nuts and seeds as you can. If you're going to do animal products, I always recommend organic as well. Let's talk about beta-glucan. Nobody knows about beta-glucan. You've heard about vitamin C and vitamin D and zinc, but beta-glucan, what the heck is that? Beta-glucan is called a polysaccharide. It's known for immune boosting and cancer fighting activities. This is research. Again, I've been researching biochemistry and neurophysiology and health and nutrition for about 35 years now. And suddenly, beta-glucan is like the new kid on the block, the new kid in town, although it's been around forever. We always knew that mushrooms, certain mushrooms like shiitake, maitake, oyster mushrooms, can help the immune system, and now we know why. It has this certain type of beta-glucan. Oatmeal has a beta-glucan as well, but it's a different type. I always thought it was the same kind. I did more research. Oatmeal has a different type of beta-glucan, so it's not necessarily as good for the immune system as this. Nutritional yeast is an excellent source of the beta-glucan that we need to stimulate the immune system. Now, if you don't know what nutritional yeast is, I want you to start adding it to your pantry and take a little bit every day. I take a lot every day because I like it. It's a powder. It looks like powdered mashed potatoes, and it's a great source of B vitamins, and it's a great source of, now we find, beta-glucan. And it has a savory flavor, maybe kind of like cheddar cheese, if I had to give you something close to that. But I love the flavor, and most people that start using it just go crazy about it. Very rich, very savory. And I wouldn't add it to something like, I've had people add it to Super Greens and Essential Source. If you had a little bit, maybe half a teaspoon, quarter teaspoon, okay. If you had too much, I personally don't like it. Some people do. It's your call what you like. I add it to salads. I add it to soups, gravies. I make an awesome mushroom gravy. My first book I ever wrote, called Eating Right for the Health of It, tells you how to change your diet. It gives you recipes. It gives you breakfast, lunches, dinners. And so many people say, Dr. Joe, I don't know what to do. Eating Right for the Health of It is a great guide for that. My second book that I wrote is called Prescription for Extreme Health. That's a whole guideline about the nervous system, digestive system, diet. They're great books, and they're on my website, drjoe.com. If you come by the office, I'll gladly have them autographed for you. But it's really a good guide. So if you like what you're hearing, go to my website, drjoe.com. Well over 1,000 hours of podcasts there, audio and video. And then we have the books as well. Some people learn from reading. I have a blog there too. You can read my blog. Some people learn from reading. Some people learn from watching. Some people learn from listening. I'm trying to give you every way you possibly can to get this information in your brain. And all those are on the website, drjoe.com. So the beta-glucan, what it does, it enhances something called NK cell activity. You know what NK stands for? Natural killer cells. So these natural killer cells are very important in your immune system, also in cancer. And if you keep the body healthy, the new research in cancer, and again, I'm certainly not a cancer expert on this, but the new research is getting away from killing the cancer. The new research in cancer is building up your immunity, immunotherapy, so the body can fight the cancer. I like that a lot better. And beta-glucan and natural killer cells are easily incorporated into beta-glucan is easily incorporated into the diet. To take about a half a teaspoon of nutritional yeast, it's very expensive. It costs about 4 cents. 4 cents, folks. The vitamin D has been shown in cancer research as well. So what are we talking about here? Keeping the immune system strong. So all of those are really easy to get. If you have enough natural killer cells in your system, this one research doctor says, you cannot contract influenza. Now, this is another doctor speaking, not me. But it's pretty cool that these options are there. So beta-glucan helps with cold and flu prevention. Studies on beta-glucan. Let's cover a few of those real quick. 2013 found that 900 milligrams of beta-glucan in the form of nutritional yeast for 16 weeks reduced the rate of cold infections by 25% and eased the symptoms by about 15%. So now we got the vitamin D helping reduce symptoms and risk. Then we got the beta-glucan helping reduce symptoms and risks. Then we can talk about what you need to avoid as well. Marathon runners who took 250 milligrams of brewer's yeast for 28 days following a marathon were 37% less likely to contract cold or flu compared to those taking a placebo. So there's study after study after study on this. And it's really cheap and it tastes good. So even if you're not willing to change your diet, at least make sure you're getting the proper amounts of vitamin C, preferably from food, unless you're in an active infection. Then you can take the supplements. Make sure it's vitamin C, not ascorbic acid. Vitamin D, I take 5,000 international units a day, especially in the winter months. In the summer, I don't take any because I'm out in the sun a lot. You can make sure you're getting your zinc, which again, fruits, vegetables, nuts, and seeds is a great source. Super Greens, essential source. The beta-glucans, nutritional yeast, any health food store will carry it. Tastes great, easy to take. Get those beta-glucans going where it should be. See how easy this is? And make sure you're getting your sleep. Studies show you're not getting enough sleep, which most adults, we need about 7 or 8 hours a night. How many people get that? Raise your hands. A lot of you, if you raise your hands, are lying. I know you're not getting the sleep. Quickly decrease your immune system, leaving your system wide open for environmental influences and blows out your immune system, makes you sick. Missing as little as 1 hour of sleep per night increases the expression of genes associated with inflammation, immune excitability, diabetes, cancer, and stress. So sleep is a big issue. Now, a lot of folks have sleep apnea. And one of the things we find in our practices is the stomach can push up against the diaphragm, again, the acid reflux, the heartburn. And when you're standing, gravity's pulling the stomach down. When you lay down, you don't have gravity pulling the stomach away from the diaphragm. You're trying to breathe. The diaphragm can't drop down because the stomach is pushing up on it. And then you have that sleep apnea. So once again, we said earlier, structure affects function. We may have to adjust or pull the stomach down away from the diaphragm so that your stomach is in a normal place so you can start breathing again. So a lot of sleep issues are due to the stomach up against the diaphragm. And if the stomach isn't digesting proteins properly, proteins break down to amino acids. The amino acid tryptophan becomes serotonin in your brain, which helps make you happy. Serotonin becomes melatonin, which helps you sleep. So this is why, from a holistic standpoint, I get so excited about this. In 34 years in practice, I'm still more excited now than I ever was. Because if you can get the nervous system working, the digestive system working, and a good diet, your body now stands a chance to stay healthy. So if you have a health issue, neck pain, back pain, shoulder pain, digestive issues, you want to talk about nutrients, go to my website, drjoe.com, and make an appointment. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Now, if you're not in the Atlanta area, I know this show goes all around the world, we could always do a phone consult if we need to. So go to the website. If you have questions, give us a call, send us an email. We're more than happy to help you in any way we possibly can. Regarding insurance, people always ask that. We take most insurances. If not, we try to match the coverage that you have. So it's not hard to be a patient in our offices. So go to the website, drjoe.com, make your appointment right now because you're suffering. So many people are suffering needlessly and they complain, why didn't I do this sooner? And my answer is, I don't know. All the supplements we talked about, the Super Greens, the Essential Source, the probiotics, the vitamin D, all the other supplements are all on the website, drjoe.com. You can get them there. So in the last few minutes we got, I'm going to try to go to some other things that you might want to consider to keep yourself healthy. We talked about the Wellness Booster. That's another product on the website. Echinacea, pau d'arco, olive leaf extract keeps the immune system strong. Seasonal tonic, ginger, horseradish, cayenne pepper, onion, and garlic pureed in apple cider vinegar. It's pretty strong stuff, folks, but I tell you what, if I get a scratchy throat, I'll take a couple of droppers of that down the back of my throat, and I'll take it, if I'm feeling sick, every hour. It says take it once a day or twice a day. Take it every hour. It's only food. You're not going to overdose on ginger, horseradish, cayenne pepper, onion, and garlic in dropper bottle-sized dosages. You can also use silver. Silver is used as an antibiotic and antiviral as well. Now, in the olden days, back in the pirate days, if you saw them in the pub, they'd have their cups and they'd be rattling their cups. They put silver coins in their alcohol. And a little bit of the silver would dissolve and it helped keep their immune system strong and help fight off viruses, germs, and bacteria, especially for, say, communicable diseases. If you were a pirate, I guess you had some unsavory interactions with some folks. And things like syphilis respond well to silver. And now a lot of research is going toward things like silver and a lot of the things we're talking about because we have these antibiotic-resistant bacteria. And they're not responding to traditional drugs, and the drug companies are trying to make stronger and stronger drugs. A lot of researchers now are going to the old methods because these viruses or germs have never been exposed to these natural treatments, and so they haven't mutated. And they're not as resistant to the natural treatment. So you can buy silver in a liquid form. It's called colloidal silver. Please make sure you follow the instructions. Because if you take too much of the silver, you can actually turn blue. I mean, like a Smurf, you turn blue. And it's not reversible. So don't take too much of the silver. Take it as you would a drug, cautiously and in small dosages. And it's all on the bottle there. Garlic is great. I'm Italian. Grandma Esposito, whenever you got sick, you know what she'd do? She'd take garlic and smash it into the olive oil. And then she'd do a blessing over it, very religious Catholic woman. And she would make you eat the garlic and the olive oil. And as a kid, well, it could be worse. Garlic and olive oil was horrible. She didn't know why it worked. She didn't know how it worked. She just knew that it worked. Now, research has shown that the allicin, the chemical in the garlic, is antibiotic, antiviral, and antifungal. Pretty cool stuff. So a lot of stuff, these old wives' tales and these old ways of treating things, they have a lot of science behind them, but at the time they didn't know the science. So increase your garlic intake. You could smash up a clove of garlic when you're not feeling well. Maybe put it in your salad dressing, put it in your soup, and the garlic works pretty well. And you're not going out anyway. You're sick, so you stink. So what? You got to cut out your sugar. If there's one piece of advice I can give you to passively, the other things are active, taking supplements. Passively, you got to cut out the sugar. 1 can of soda, and it's in my book, Prescription for Extreme Health, 1 can of soda can weaken your immune system by about 14 times short term, just the sugar in 1 can of soda. So I know it's hard in the winter because that's when we do what? Halloween, and we have Thanksgiving, and we have Christmas, and we have parties, and we're going to holiday parties, and then there's alcohol on New Year's. You can't do that, folks, in the winter. You got to do the proactive steps, taking the supplements, keeping your body healthy, getting to sleep. But you also got to cut out those sugars. Is it hard to do? Yes. Is it worth it? Yes. If you want to get healthy. If you don't want to get healthy, that's okay too. But prepare yourself. It's very expensive to get sick. You'll miss work, you miss family time, you miss interactions, friends. It's an expensive on your immune system too. Not just a financial expense, but it's very expensive on your body. Got to cut out the sugar. We talked a little bit about the leaky gut syndrome earlier. If you have acid reflux, heartburn, burping, gas, bloating, you may have to pull the stomach or have us pull the stomach away from the diaphragm so you can start digesting your food and then getting on healthy foods to let the gut heal. And then Dr. Joe's probiotics, another good thing you can take to help rebuild the bacteria in your colon, the good bacteria. We talked about the raw food. It really is important. Enzyme supplements. We have another supplement. I have Dr. Joe's enzyme support. If you take enzymes with a meal, they help digest the food. If you take them on an empty stomach, they can be absorbed into the system. And then that can actually help a little bit fighting off viruses, germs, bacteria. Because the problem with a lot of viruses is they're coated. They have a coating on them, a biofilm it's called. And with the biofilm, the immune system can't recognize it. The immune system the white blood cells fly over it and go, yeah, that's fine. I don't know what that is. When the enzymes help dissolve the biofilm around the viruses, then the immune system can start attacking them. Kind of breaks down the shield, if we're talking Star Trek terms there. Elderberry. I had somebody call me the other day and they said, Dr. Joe, my kid's sick. What do I do? And I talked about the zinc and the vitamin D. But elderberry is also very effective in helping the immune system. Now, don't eat elderberries. They have to be cooked or else they're poisonous. So if you buy an elderberry, it's usually a syrup. Elderberries are extremely effective as part of this whole regimen as well, and most kids like it because it tastes good. So you can do an elderberry syrup as well, and that's another thing you could add to your repertoire. So if you go to my house, I have the probiotics, I have the vitamin D, I have Dr. Joe's enzyme support, Super Greens, an essential source, nutritional yeast, beta-glucan, I eat foods that are high in zinc, and then I also have some elderberry syrup there as well, just in case something gets into my immune system that my immune system doesn't know what it is. Maybe I'm stressed out, I've been exhausted, I'm working too hard, too many radio and TV shows, too many patients. I like to make sure I'm staying strong. And then we talked about the vitamin D. You want to make sure you keep that strong as well. So if you're just tuning in, you missed an amazing show. Good stuff. If you want to hear it again, go to my website, drjoe.com. Share this with your friends. Go to my website. We have audios, we have videos. Share them with your friends. Follow me on Facebook. Follow me on Instagram. Many times we do shows. We live stream them there. Send me your email address. I promise you I'll never give out your email address. We send out a newsletter maybe once or twice a month. A lot of good information. And sometimes we have specials on supplements. Sometimes we have specials for new patients. Sometimes we have a special event that we're only inviting our newsletter folks to. Maybe it's a live lecture or something going on in that area. Send us your email address. We'll be more than happy to add you to our email list. We'll never, ever give out your email address, ever, I promise. The supplements we talked about, all on the website, drjoe.com. If you want to make an appointment to come see us, we have chiropractic offices in Marietta, Duluth, and Stockbridge in the Atlanta area. We would love to be your doctors. Imagine getting your nervous system working, getting out of pain. Then that's going to help the immune system. Because pain, by the way, aside from pinching nerves to organs, also causes inflammation. getting the body healthy, fixing the digestive system, the acid reflux, the heartburn, the burping, the gas, the bloating, and getting your nervous system, digestive system in a good diet with some good supplements in there, it's a pretty good place. If there was a better way to obtain and maintain good health care, I would be doing it. I've researched for 35 years. Every time I find something that's going to help the repertoire we put together for our patients, I add it to our treatment plans. But if there was a better way to do it, I'd be doing it. And you should too. Go to my website, drjoe.com. Make an appointment for you, your friends, and your family. We want to help get you well and keep you well. I'm Dr. Joe Esposito. Thanks for listening. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.